This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday morning. Thanks for joining us on WAJR. I'm Kyle Wigg sitting in for Dave Wilson. And our guest this morning, Jamie McLaughlin, Senior Director of Critical Care and part of the Mon Health Nursing Education Program as well. Jamie, good morning. Thanks for coming on. We appreciate your time.
Good morning.
And we also have Jeremy Zeiders. He's with Donor Family supporting the coordinator for CORE. And Jeremy, welcome to the show. We appreciate your time.
Thanks, Kyle.
Let's talk about this program that you have. It is Donate Life Month. So April is Donate Life Month. And Jeremy, let's start with you. What is your role with the Center for Organ and Recovery and Education?
Yeah, so CORE is an organ procurement organization, one of 56 throughout the United States that has a service area. So CORE service area is Western Pennsylvania and the vast majority of West Virginia. There are 6 counties we don't have in the panhandles and out on the fringes, but we have the vast majority of West Virginia as our service area. And we are here to save and heal lives through donations and make it all happen, from educating folks in the hospital to working with doctors for procurement, and making sure that those folks that choose to save a life, to be a hero that way, can do so. And that happens right here in our hometown, right here in our backyard.
Mm-hmm. Jamie, what's Mon Health's involvement in this?
Well, every year,
Go ahead.
educating our public, we participate in several table displays. We help members of our community and our hospital register to be organ donors. And we also have an annual flag raising event every year.
Mm-hmm. Okay, Jeremy, when we talk organ donation, exactly what are we talking about? Obviously, heart and lung, but there's so many other aspects to it, right?
Yeah, so and I kind of separate a little bit. Organ donation saves lives, and then tissue donation enhances lives. But it all comes together from that person that at the end of life chooses to be that hero and to help someone else. So organ donation itself, one good, healthy organ donor can save up to 8 lives through those organ transplants. And one healthy tissue donor can help or enhance the lives of up to 75 others and give them the gift of sight through cornea donation.
Mm-hmm. Well, that's an incredible number. So one organ donator can save up to 8 lives. And when you talk tissue donation, you mentioned the corneas. What are other aspects of that?
Yeah, I mean, so I coached football for a long time at University High School, and one of the things that we encounter when you're in sports or athletics is, something like an ACL or a joint injury. So part of tissue can be used to replace that. You can get a cadaver tendon in order to replace that ligament that's damaged. A lot of dental work, so folks that need dental help where they're looking for an implant, a lot of times they will use donor bone paste or donor bone putty, which is created by somebody donating that bone that gets crushed and sterilized, and then it can be used to thicken and strengthen that bone in order to be able to hold something like an implant. It can also be used to strengthen, like, say, spinal stenosis. And so it can help someone who's just looking for that life enhancement where they have a chronic issue that comes from pain or something happening to them where they've lost some ability to function, and that ability can be returned. And that all happens after that patient has passed. That recovery occurs, and it does not preclude an open casket funeral. There's no interference to that. It's done surgically through national certified standards, the same way you would if you were going in for a surgical procedure at Mon Health. Okay,
there's so many things there that most of us would not think about. That with a simple decision to be a donator, an organ or a tissue donator, you can help so many people. I mean, there's just so many aspects to it. Jamie, can you kind of elaborate on that? How important it is from your perspective to to have these type of things available when someone makes a decision to be an organ donator or a tissue donator?
It's very important. I think in the United States we have over 100,000 people waiting on life-saving organ for organ transplantations, and I think in West Virginia, Jeremy could probably give you the more specific number, but we have over 500 people on the organ waiting list. So it's very, very important that we educate, potential donors.
Mm-hmm. Is it as simple, and this is for either one of you, is it as simple for someone like me, perhaps, whose driver's license expires in July when it's my birthday? I go to the DMV and I check the box on the back of that driver's license application to become an organ donor. Is it as simple as that for those of us who, have the ability to consciously make that decision?
It is as simple as that, and at the same time, it is a little more complex. I think there's, we're putting a call out to people to be aware when you go to the DMV that box is there. West Virginia has one of the lower designation rates in the country currently. We're under 40%, which means, so if you're standing in a crowd of 10 people, likely 3 of them are registered to be donors on their license. And so we're kind of pushing a little bit to make people aware that is out there. In West Virginia, you can also check that box on your hunting and fishing license. And there's also websites that you can go to, like registerme.org, which is a great site that has a lot of information on it, but also be, willing to put you on a registry to be a donor.
Mm-hmm. Jamie, what are some other ways that people can make known that they're willing to do this? They're willing to make this decision to help others when something unthinkable happens?
Well, as Jeremy said, registering on your license, driver's license, hunting license, and even when we do our table displays, there's a QR code that we have on a brochure that you simply, scan it, open up the website, and it literally takes, 2 minutes maybe to put your, name, your information to be an organ donor. And, as West Virginians, we want to step up and we want to change that number. So we're doing everything on our end at Mon Health System to help with that.
Okay, and there's an upcoming Core Donate Life Month event. I guess perhaps more than one, right? Jamie, can you kind of elaborate on that?
Yeah, absolutely. Throughout Mon Health System, all of our hospitals participate in flag-raising events. We have our Donate flag that we hang and leave up for the whole month of April, just as a sign of remembrance and hope to honor those individuals and their families who've been touched by organ donation.
Mm-hmm. Jeremy, anything to add there?
So we travel all over the state. Hospitals participate, and they tend to bring out a speaker that is a recipient or a donor family that was helped in some way by organ donation to help spread the word. So it's really a celebration of life. We have quilts that are on display from families who will give a quilt patch that honors their loved one for being a donor, and then we build those hero quilts. And they travel around our service area with us and honor those folks for supporting that gift of life.
Jamie, how does this is obviously a very delicate subject, because if someone's in a position where, something tragic has happened or something as horrible has happened, but they've made the decision to be an organ donor, how does that process work? At the very end, I've checked that box on my driver's license, and my family is there, and they are aware of that. So, just kind of getting the process going. How does that work?
It is very difficult, and it's heart-wrenching when it happens. But we bring in our core representatives. They're the experts trained to speak with these families, and they pretty much take over from there. We rely on them, and they're trained, and, they have, the answers for these families.
On the other hand, again, this is all about, as you mentioned, Jeremy, a celebration of life. Someone is the recipient out there of something wonderful that can maintain their life or save their life, perhaps.
Yeah, I think we need to recognize, some simple diseases like high blood pressure and diabetes and even a common virus can destroy your body's organs. And we're all more likely to need an organ than we ever are to have the opportunity to donate one. there's if you look at the number, the average attendance of Mountaineer Field is 58,000, right? So if you put two Mountaineer Fields together, that's the number of folks you have in America that are on the wait list for an organ. And we lose someone about every 10 minutes or 17 a day that are waiting for the life-saving organ transplant that don't have the opportunity to receive that organ. So for us to drive that, to be able to drive that through this process, when you talk about families and what happens to them when they're in that situation, it is never an easy moment to choose for someone to be an organ donor. It's actually a stressor. And so we try to get families to have those conversations ahead of time and to know. And when CORE steps in, we lead with compassion. And that is what we are there to do, to help that family through that really difficult time. And I really, truly feel like it does provide a little bit of help for someone in their grief as they process that down the road, knowing that something good came out of that tragedy.
Yeah, absolutely. I mean, it's very difficult, and again, this very delicate situation when something like this happens. So, if I know for a fact I've got the box checked on my driver's license to be an organ donator, but if someone is in the position where their loved one has not, is it still too late for that person to be an organ donor, or how does that work?
So that's a great question, Kyle. So the hospital has some different triggers that they have to make a referral for someone that is in that position. And they will make that referral to CORE, and CORE will send someone to have that conversation with that family that is very delicate and requires that compassionate chat. And really what we're trying to do is give the opportunity for that family to choose a legacy that they can find strength and comfort in. That legacy that in their last moment, their loved one did an act of love and saved someone's life.
So once that decision is made and the person, it's determined they are going to be an organ or a tissue donor, then what? How does that process work? Maybe, Jamie, that's a question for you.
We actually let the CORE representative coordinate all of that for the patient and the family. Jeremy, if you want to.
Yeah, so that really is about taking a look at that donor and seeing what is, able to be transplanted. That's making sure that we have compatibility through blood testing, like we have blood compatibility between our donor and our recipient. When we begin to allocate the list, all of those matches go to the transplant surgeon. So the transplant surgeon is making the decision if that organ is the appropriate organ for their person on the wait list. The wait list goes by the patient that is the sickest, and so the patient that is closest to death on that transplant list is the one that gets the first look. And, Vandalia Health has a kidney transplant center in Charleston that does a lot of kidneys, that tries to help folks who are waiting on that kidney list. Mm-hmm. And so it's a process where we allocate the organs and the transplant teams decide if they want that organ, and then we work with them and to fly in to the hospital and to make that recovery and get that organ back to that life-saving transplant.
Now, I know this has gotten I've got a little bit of personal firsthand knowledge about how some of these things work, specifically kidney transplants. I know that it's gotten to the point where it's evolved to where there are exchanges, correct? I mean, how much are you guys, this organization, involved in that? A kidney comes from one place, goes to another, and a kidney goes from that place. I know there's sometimes 3, 4, 5-way exchanges now.
Yeah, so that what you're describing is living donation, and Vandalia Health does have a living donor program in Charleston, and that is all done by the transplant side, which is done at the hospital, which is separate from our side. So CORE works with donors and donor families, but we don't really work on the transplant side. So if you are interested in being a living donor, you can certainly do that, and I would encourage you to contact your local kidney transplant center, and they will work you up and try to find a match. There's about 80,000 folks on the national registry who are waiting for kidneys, and sometimes kidney wait list is a bit longer than the other organs because of that, and that is also because it could be supported by dialysis. Right. And so you can keep those folks that are in kidney failure alive. So that is really, really important, and those folks at those transplant centers do a great job of making sure that those chains occur and that folks are coming in to be part of that process to help save through kidney donation.
Right. Is kidney, is that the one thing that's mostly most in need, or what are some other things that there's incredible demand for?
Yeah, I mean, you can save one healthy organ donor can save 8 lives. That would include the heart, the lungs, where you can split the lungs. You can have 2 different individuals each get 1 lung. You have the liver, the pancreas, the intestines can be transplanted, and the kidneys as well. The kidneys are almost always split from a donor, where 2 different individuals are each getting 1 kidney, and that 1 kidney functions as well as 2 kidneys. In West Virginia, we're really high on our chronic kidney disease, and so. It is important in our state we know how many dialysis places there are around the state to help those folks that are awaiting life-saving kidney transplants.
Right, very good. Guys, we need to take a break. Stay with us, please. We'll take a quick break. Jamie McLaughlin with us, Senior Director of Critical Care, Mon Health System, and also Jeremy Zeiders with CORE, Donor Family Support Coordinator for CORE. It is Mon Health Talk for this Monday morning. We'll take a break. We'll continue the conversation coming up after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk continuing on this Monday morning. We've got a few minutes remaining with Jamie McLaughlin, Senior Director, Critical Care, Mon Health Systems, Jeremy Zeiders with CORE, Donor Family Support. And guys, again, just a couple minutes left. But Jamie, if someone's out there listening and they need maybe that last little nudge to go ahead and check that box on the driver's license or some other way, register to be an organ donor, what would you say? What advice would you give them? How would you encourage them?
I would encourage them to absolutely do it. As we said, the amount of people in the state of West Virginia that are registered to be organ donors is low, and we want to change that. So registerme.org, they can go to easily sign up to be an organ donor. monhealth.com/healthfair is another option if they want to look at events throughout Mon Health System.
Mm-hmm. Jeremy, same question for you. What would you say to encourage people to make that decision to help others?
I mean, I would say, for one, anyone can become a donor. We had the oldest donor in American history happened at CAMC, or Vandalia Health, in 2021. He was 95 years old, and his liver was able to be transplanted and saved the life of a 63-year-old. And so, I think there's a lot of myths we have out there about donation that keep people from registering or keep people from saying yes if that time comes. But there is a separation. The doctors in the hospital are there to be the life-saving team, and they're there to save your life. And when it comes time that if they can't do that, unfortunately, then they call for the organ procurement organization to send requesters in order to handle those next steps of end of life.
Man, that's an incredible story. A 90-plus-year-old individual helped someone in their 60s, huh?
Yeah, I joke about it, Kyle. Like, of course it was in West Virginia. But Cecil lived down in McDowell County, and he was a World War II vet, and he owned coal companies. And we learned later that his son was actually a tissue donor, and Cecil himself felt like it helped his own grief, knowing that his son's last act was to be helpful. And so he wanted to follow suit, and his family was on board. And his liver was pretty healthy. And so, Cecil is a hero. That 63-year-old wakes up every day and is thankful for Cecil that he gave the ultimate gift so that they could live on.
Yeah, that's incredible. And if you're listening out there, you can too. Again, how can, Jeremy, quickly, how can people donate other than checking that box on their driver's license? That's the easiest thing, but what are some other ways to do it?
Yeah, you can go to core.org. There's some information on there. There's ways you can volunteer to help with your hospital system or with CORE. Registerme.org is a great place for you to check that box as well. And then just, it's about humanity and compassion, right? All the major religions support donation because of the humanity and compassion of it all. And we certainly don't want to see folks have a tragedy and end up in that position. where they could potentially be a donor, but it's also something that we can't really stop from happening. And so if you are in that position, we ask people to choose life and to help that person become a hero and to save those folks on the wait list.
Absolutely. Guys, great information. Good show today. We appreciate it. Jamie, thank you for your time.
Thanks, Kyle.
And Jeremy, thank you as well.
Thanks, Kyle. Thanks for having me.
Something really to think about there in terms of organ donation, and a lot of good information there. That's Mon Health Talk for this Monday. Thanks for listening. Stay tuned here on WAJR.